Hi, this is Debbie Pate. We're going to be talking about role transition from LPN to RN. The role transition we're going to talk about today, we're going to start off with a scenario. Talk about Jeff. He's an LPN and nursing transition program at a local community college. Jeff feels the transitions class is not really necessary because he's been dealing with transitions all of his life. His nursing career began in high school when he worked as a nursing assistant in a nursing home. After high school, he became a qualified medical assistant, and eventually he became an LPN. So here he is now working on his associate degree to further his career. He thinks, what's one more step up the nursing ladder? Jeff feels that making a bed is making a bed. Passing medications is passing medications. Nursing is nursing. Have you not thought about this yourself? He says, what's the big deal? I am already doing everything that the RN is doing. Well, let's ask ourselves these questions. How did Jeff's responsibilities change for each of his nursing roles? From nursing assistant to LPN and now finally to RN. Do you think his employer or other members of the healthcare team had higher expectations as he climbed the nursing ladder? Do changes in roles such as moving from LPN to RN affect the attitudes of co-workers towards you and towards what you're doing? As you move up towards your RN role, how do you feel that you will respond to other healthcare team members, such as your UAPs or your LPNs? So let's talk about role socialization because it is all a process. As you move through the process of becoming a registered nurse, your job requirements, expectations, and work responsibilities will change. This is a process and it will not change overnight. The role socialization, as you move through this educational process, you're going to find that your clinical nursing skills will expand. You will acquire new critical thinking abilities, and you will internalize a new person identity. Developing an internal positive attitude towards change will help in the process of acquiring the needed skills to become a professional nurse. You need to have that I can do this attitude when we talk about that internal positive attitude. So often we hear students talk about there's that voice that keeps saying, I can't, I can't, I can't. But you've got to have that internal voice that says, I can no matter what, because this is my goal. During the process of becoming an RN, it is important for you as the LPN to value your past education, but at the same time, we want you to meet the challenge of accepting the new ideals, improving your critical thinking skills, and learning new nursing techniques. If we look at the definition of role, we can see that it's a set of expectations society assumes a person in a certain position or occupation will perform. This implies a change in one's role requirements, expectations, and work responsibilities. It also requires an internal change in the way one thinks or views the new role. So viewing the transition as a challenging opportunity will help you prepare emotionally, mentally for the growth process. And here's just some of the different roles and the elements of each role that you're going to be involved in. The next slides, we will go over them in detail. The caregiver, you're going to assess the client, analyze the collected information to determine the client needs. You're going to be the one that's going to develop the nursing care plan, and you're going to be able to use your therapeutic communication skills to relate information and to explore clients' feelings and thoughts. As an advocate, you're going to be the one who speaks or acts on behalf of another person by interpreting information from other healthcare team members. As an educator, every time we go in the room, we're always talking about, the plan of care, or we're talking about the intervention that we're there or assessment that we're doing. Basically, in this setting, we're going to continue to do all those things, but you're also going to be talking about health promotion, disease prevention, and any kind of treatment. As a collaborator, you're going to be able to interact with personnel of all different departments that are coordinating the care of this client. and a change agent if you are in the process that you see that there needs to be a vital change with this patient in their level of care. Also, as an educator on a daily basis, like I had mentioned earlier. As a communication, you're going to be the important one that's going to build that trust relationship with those clients, using your therapeutic communication skills. And then as a counselor, you're actively listening, and you're using your communication skills again to help that client make choices that determines his or her health outcomes. And then as a mentor, a wise, loyal advisor. And then manager and leader, sometimes we think of this as a higher level of that expert nurse, but we have to understand that we are a manager and a leader, just with the patients that have been entrusted to us, that we're a manager because we're now overseeing their care, and we're managing those that are working with us as an LPN or a UAP. And we're helping to coordinate that plan of care and the care that this patient might need. As a leader, as we become that expert nurse and become more comfortable with our role in this, we would become like managers of units or clinics. So in order for us to know that there's a role transition, you have to know there are differences between LPN and RN. In educational levels and critical thinking levels, assessment skill levels, care planning, legal responsibilities, IV therapies, communication, and patient teaching skills. And we look at the National Council of State Board of Nursing, which is a collaboration of all the states and their nursing boards, of the different roles that an LPN and an RN hold. And we'll look at the LPN first. The LPN is looked at as a directed scope of nursing practice, and they are under the direction of the RN or an advanced practice RN, or the physician or some other healthcare provider as authorized by the state. They're always going to practice as under the nursing standards that have been established by the board, but their nursing practice and process will be guided towards those patients who are stable. Whereas with an RN, their scope of practice is going to be more encompassing. It's going to be caring for clients in all settings, including providing comprehensive and extensive nursing care for patients. We're going to be able to collaborate with a nursing team. We're going to be able to make some decisions of care and provide an integrated client-centered healthcare plan. We're going to have to be able to acquire and apply critical new knowledge and technologies and management and supervision of the practice of nursing. So it is a different level. I think you would agree with that. Most of these things actually all of these things that we're talking about today and the socialization is in your chapter 4 of your RN to LPN book. One of the areas that we'll end with is called the professional socialization. So there's two levels to that. There's a formal and an informal. The formal is what we are doing in class, in school. It's a guided level that says that at the end of this you should be able to accomplish these different things in order to have successfully completed the formal socialization. It's a process you must undergo to become an RN. It is planned educational experience, such as performing physical assessments, developing nursing diagnosis of the patient's plan of care, and doing patient teaching. Informal socialization is something maybe you hadn't thought about. It's a process of lessons learned incidentally while you're functioning in a student role, like evaluating lab values before administering medications, because you've watched a staff nurse who's incorporated this into their practice. We have to understand to effectively embrace the role of the RN. We must take advantage of both the formal and informal socialization opportunities, and thereby change in the ways we view ourselves. Last but not least, we'll end with this, and this is also in that chapter 4. It's on page 58. And it's called about the stages of transition. As you go through this professional socialization, you're going to see that there's going to be some things that you experience yourself. So the different stages, there's stage 1 through 4, and you will progress through these. Your honeymoon phase is usually when you've made the decision that you're going to be enrolling in school, you got accepted into this program, and you're going to have an increased awareness of purpose and confidence. And that will usually last until you are encountering material that becomes challenging and it causes anxiety. So then you leave the honeymoon phase and go into the conflicts phase. That's when the new and different nursing concepts are introduced. It causes conflicts with the roles that you presently are holding. It conflicts or it challenges you with the previous knowledge to your new knowledge that you're being introduced to. And it causes uncertainty and self-doubt. With that comes sometimes an overwhelming feeling of doubt, of fatigue, of anger. You start to want to blame someone else for your lack of perceived success. Remember, this is a normal progression and it is experienced by all. Sometimes this goes inward and it causes anxiety that turns into depression and withdrawal, or it can cause you to turn outward and the frustration becomes hostility towards others, whether it be to faculty or to the program itself. So as you experience this, know that this is a normal progression. Stage 3 is the stage which begins letting go of the LPN way of thinking and accepting the RN thinking patterns and behaviors. This requires self-assessment of learning needs and display a willingness to accept and adopt new nursing knowledge and skills. As acceptance takes place, students will become less frustrated. And you will become less frustrated. You will appear to be more relaxed about the program of learning. And then at the end of that, of letting go, then there's a resolution phase. That's when the meshing of school, work, personal life happens and you understand the demands and adjust new coping skills. This occurs when you completely adopt the new attitudes and behavior needed to resolve to learn a new way of thinking and the demands of becoming an RN. So that's the end of this session, and we'll go on and we'll pick up with Chapter 6, Educational Pathways and Expanded Roles next. So we'll end this session and then we'll start with a new one.